Hello, my name is Andrea Everts, and welcome to Great Blue Heron Wellness.
Well, the rest of the world is using this much more than we do. With a person who's had a stroke, for example, the brain actually will grow new blood vessels into the area that's stroked. The inflammatory process, wherever it is being addressed in a way that's really good for you. There aren't side effects that you have to balance. So that's applicable for people dealing with MS, but also for people dealing with Lyme. Our lifespan looks like it's supposed to be like 150 years. This is the kind of thing that you think, okay, that's how we get there. Hi, I'm Dr. Grace Johnstone. I'm a chiropractor. I've been in practice about 25 years. 3 years ago, I became certified in hyperbaric and undersea medicine.
So, what is hyperbaric oxygen therapy?
Hyperbaric oxygen therapy is the medical use of oxygen at higher than normal baric pressure. And normal baric pressure means what we all live at primarily, like the pressure we're at right now, what we think of as normal. When we increase that pressure, oxygen has a whole different effect than what it does at this level. In addition to this, it also has other effects. And so that's part of what we're employing when we use hyperbaric oxygen therapy.
Okay.
Yeah.
Okay. So, how did you discover this type of therapy?
As most of the gifts in life, it was a total accident or on purpose, depending on your perspective. I had a really serious case of Lyme disease, kind of a rare strain that goes directly into meningitis and cardiac issues. And about a year later was still, not able to work or read or sit or walk or dress by myself. It was pretty incapacitating and incredibly painful. And I was really looking at, how long do I want to do this? And in the typical Vermont way, friend of a friend, someone heard about my situation who had a hyperbaric chamber at home. Their daughter had almost died from Lyme. She was seizuring constantly for a number of months, and they couldn't figure out why, and it turned out being Lyme. They got a hyperbaric chamber at home, and she and the daughter used it every day, and the daughter is now fine. She heard about me and offered to let me use her chamber.
Wow, how long ago was that?
That was just a little over 5 years ago that I first got sick, and almost 4 years since I heard about the hyperbaric.
Okay.
And started using it, yeah.
And so when did you notice a difference?
I could tell the first time that something was happening that hadn't happened so far. And so I did what I needed to get a chamber at home because I couldn't drive. I couldn't get in and out by myself even. At this point, my parents had moved in with me because I couldn't do things by myself. So in any event, they went home probably a couple weeks after I got the chamber.
Wow.
And that was huge.
Yeah.
That was just huge. Yeah.
So I'm just curious, we haven't talked about this before, but did you test positive for Lyme?
I did eventually. I tested negative the first time, and then later I tested positive, and also for some other co-infections.
Okay,
So-
but at first, you did.
No, I think at first it was negative, right?
Yeah, because
which is
that
not
happens,
uncommon.
That's like 50% is my understanding.
Yes.
Of people are testing negative for Lyme that might have it and might test positive later. I think
Yes.
this is really important to point this out. A lot of people don't know about this.
Not that they're doing a bad job. It's
No.
just that the available testing is so poor, and it's a hard thing to get right.
Who would this be good for then, hyperbaric? Is it just people with Lyme or?
No, although it is particularly good for those people, in part because the Lyme, the spirochete that gives you, that carries Lyme, that gives you Lyme, is what they call a microanaerobe. And so it's capable of living in very, very low oxygen. So hyperbaric is interesting because we are perfusing the entire body, all the tissue, with oxygen. You really can't hide from it. It's not reliant on the blood supply because we're oxygenating plasma and cerebrospinal fluid and joint fluid and the gut fluid, for example.
Mm-hmm.
So you can get to those hidden Lyme spirochetes. One of the effects of hyperbaric oxygen, I should say, is that it's a really powerful anti-inflammatory. And that is the big answer to your question in terms of who is helped by this. Because certainly Lyme creates inflammation wherever it is in your body. That's why it looks so different. It can give you palpitations, it can give you meningitis, it can give you irritable bowel, it can give you vertigo. It just depends on where it is. And it creates that inflammation wherever, and it moves around. And this is a really powerful anti-inflammatory. So in addition to killing the Lyme, you're actually helping resolve that inflammatory process in the body.
And so this is a process of diffusing inflammation in the body by actually going and doing some relaxation and deep breathing.
Yeah. It's very nourishing. The brain loves it. It speeds tissue healing, all kinds of tissue healing. So muscle tissue, bone tissue, brain tissue. It induces healing on the part of the brain and plasticity, what they call plasticity on the part of the brain, in ways that we didn't know the brain was capable of, showing brain recovery from traumas that were 5 or 10 or 15 years ago.
Okay, so it sounds like a cure-all.
It does.
And
you know, really, when you get to the part about speeding tissue healing and dealing with inflammation, almost all our pathology relates to inflammation of some sort.
in the modern day, that's
It really
really
does.
true. That's really true.
Yeah.
So what are contraindications, though? Who is this not
Certainly.
good for?
And this is where I should make a distinction. We are doing what's called mild hyperbaric oxygen therapy,
Okay.
and that means that we're using chambers that go to 1.3 ATA. New research, and by new, I mean in the last 10 to 15 years, which in medical research is considered new, demonstrates very consistently that actually mild hyperbaric is often better for most conditions than the high pressure systems are. They're not challenging to the nervous system, the brain. You don't have to worry about oxygen seizures or toxicity, for example. Some of the things that if you went online and Googled hyperbaric oxygen, risks, you'd come up with a list of these things that are true if you're doing higher pressures, and they monitor them very carefully. So we're talking about what they describe as normalizing immune function. There's a good one. So one of the concerns from people who know a little bit about hyperbaric but not a lot is that if this speeds tissue healing and tissue growth, which it does, what would happen if you had cancer? Would it speed cancer growth, or would it speed metastasis if that was going on? And so there's actually been a lot of research about that, and all coming down to the effect that it does not. And in fact, there are a number of studies that show that metastasized cells, when exposed to longer-term hyperbaric, actually start to normalize. They become less and less aggressive. So when we look at the rest of the world, their FDAs have approved this for between 60 and 120 different conditions. Now, here in the US, it's 14. That is not because there isn't research. It's because we haven't gone through that process for each of these conditions through our FDA.
So if someone was interested in contacting you directly, we'll have Dr. You could tell us your website now, but we'll put
Certainly.
that on there.
The first treatment center that I started is at my chiropractic office, and that's communityhyperbaric.com. So that's an affiliate now of Hyperbaric Vermont. We have, as I said, similar pricing, similar protocols. There are very good research pages on each of those websites that you can look at if you want to look into a particular condition and see what's been published in terms of scientific and medical research. There's a lot of information there around hyperbaric in general, where to seek treatment, how to buy a chamber if you'd like to, that kind of thing.
If you wouldn't mind, Dr. Johnstone, just a recap.
So basically, anyone who's dealing with any kind of chronic inflammatory or degenerative process, anyone who's dealing with a non-healing wound, this really stimulates the brain to heal and grow. Anyone dealing with autoimmune issues, we have successfully treated people with MS, with some of these degenerative changes in the brain that may affect Parkinson's, for example, affect different parts of the brain. We've consistently seen good change in people who are doing that. We have a woman with MS who's now not in a wheelchair anymore after 10 years. We really get back to what's happening physiologically, which is the powerful anti-inflammatory effect, normalizing immune function, supporting the detox process, increasing neuroplasticity, speeding tissue healing of all types of tissue, gut, bone, muscle, brain, increasing stem cell proliferation, the antimicrobial effect. What we're seeing In terms of long-term use, they have now done research into over 8,000 different genes. All of them, when we get into 30 and 40 treatment hours, are down-regulating things that create cell death or aberrant cell growth, and are upregulating things that speed healing and growth in tissue.
Wow, I got goosebumps when you said that part about the genes.
It's exciting.
Well, it also might mean that what your parents had,
Right.
you don't have to have.
Right. Exactly.
There are things we can do now
Yeah.
with fixing nutrient deficiencies, which you know I'm big on, but also possibly
Yes.
doing different therapies which will help your body rebalance itself.
Two of the big categories that I didn't mention are traumatic brain injury and dementia.
Yeah.
We have had 6 or 7 patients with dementia completely recover, and some gain functioning so that they can now be by themselves, don't need 24-hour-a-day care. When we look at the diseases of aging, what we think of as normal aging, they're accumulated inflammatory processes affecting different parts of the body. When the human genome is our lifespan looks like it's supposed to be like 150 years. This is the kind of thing that you think, okay, that's how we get there, given, our environment and stresses and traumas and toxins and all of the other things that we have to deal with. That's how we get there.
Thank you so much.
Thank you.
Thank
A pleasure.
you for being here.
Yes,
Absolutely.
appreciate your sharing this.
Yeah.
It's important.
Yeah, and I appreciate you. When I came up here and after just a few treatments, my brain started working differently, and it's helped me with my detox and moving other things out of the body. So I'm really grateful. Dr. Johnstone was really clear to explain that the research supports that this helps the brain regenerate, which we didn't think that was possible
Right.
20 and 30 years ago. I really thought I was just a goner,
Right.
and I was so down on myself about the whole experience. I was like, why try? But you should keep trying. I don't know if this is right for you. I know it helped me, and it also helped Dr. Johnstone. Thank you very much for being here today. Thanks so much. This is Great Blue Hair and Wellness and Andrea Everts, supporting you to be the light on your journey. Thank you. Thanks.
Lovely. You're very welcome.